Now, the governor's in the room, heading up to the podium with his health commissioner. Let's go.
Good afternoon, everyone, and good afternoon, Minnesotans. I've just signed Executive Order 20-01, declaring a peacetime state of emergency for the state of Minnesota, dealing with the coordinating of Minnesota's strategy to protect Minnesotans from COVID-19. Yesterday, the World Health Organization declared COVID-19 a pandemic, and over the past week, we've seen an increased number of cases in Minnesota, from 9 yesterday to 14 today, with 2 of those hospitalized. Our thoughts and prayers go out to those that are infected, their families, and a special thank you to our healthcare workers who are on the front lines. Based on the experience of other states and the message we're getting from our healthcare community, we are going into a heightened state of readiness to protect Minnesotans. As we look to the future, over the past several weeks, we have forecasted exactly this scenario. The systems, and I stress the systems that are in place to deal with this in the Minnesota Department of Health and in our private sector healthcare is prepared to deal with this. The mechanisms to be able to make sure they're able to do that are what will change. A peacetime state of emergency will allow the state of Minnesota to respond more rapidly as issues evolve. I would ask you all to think of this as opening the toolbox. We're not taking a tool out of it as of today. In terms of things that we can do. And for some of you who are familiar with peacetime states of emergency, they can involve things like the activation of the National Guard as the Commander-in-Chief to be able to call them forward. We're going to continue to keep the public informed on our daily efforts to fight this pandemic in partnership with our federal and state allies. Yesterday I spoke with Vice President Pence. Today Dr. Birx followed up. One of the issues that we are expressing concern about is the ability of testing and the ability to get testing as far as possible. We think there are solutions being worked, but I'm going to leave that to Commissioner Malcolm when she comes up. I also want you to know the coordination with our federal partners. We just got off a call with the entire congressional delegation, briefing them on what the Emergency Executive Order 20-01 will do and the efforts we need to coordinate with them. I also spoke at length this morning with Governor Pritzker of Illinois and Governor Whitmer of Michigan. They are following a very same trajectory of ours and the decisions that governors are needing to make. I think what we're seeing is that a coordinated national effort and a common message would certainly help in this effort, but our individual states' healthcare systems are prepared to deal with this, and when governors are coordinating on previous experiences, it's helping inform the decisions we're going to make. I'd also like to call on the state legislature, and again, a thank you to them for the proactive measures that they have already taken, the bipartisan work that we have done. Last evening, as many of you know, we had a very unusual, I think, and a somewhat rare gathering of the 4 legislative leaders, myself, and the Chief Justice of the Supreme Court to talk about the continuity of operations for the state capitol and for state government. What I would like to do is ask them to move on a few legislative priorities and to try and do so quickly, because the situation may become, as we've seen in Canada, where Parliament has been suspended. They need to maybe take the action now. We're talking about creating a COVID emergency fund, removing some of the financial barriers for Minnesotans who need to be tested, expanding the use of paid sick time, and providing long-term care facilities with more resources. I will let you know that we are in contact with that, whether it was Dr. Farouj at the Mayo Clinic or the folks with the long-term care facilities. We were calling them and giving them a pre-briefing on what to expect, obviously, over the last few days and what they need in this executive order. There's more work that needs to be done. Minnesotans need to work together to combat COVID, and we need to make sure that the tools that are in this executive order are able to be put to use. Today, we're going to be announcing community mitigation strategies for all Minnesotans to follow in school, in work, in social settings to ensure the safety and well-being of all Minnesotans. The state of Minnesota workforce, in our state workforce, is now modeling and executing these guidelines across all of state government. I'm going to turn it over now to Commissioner Jan Malcolm, Minnesota Department of Health, to explain what we're asking Minnesotans to help us do to ensure the safety and security of not only themselves and their families, but their neighbors and other Minnesotans. Commissioner Malcolm.
Thank you, Governor. Good afternoon. Thank you. Today, we're announcing a series of community-level strategies to help slow the spread of novel coronavirus in Minnesota communities. We've rightly been focused heretofore on individuals who are sick or may have been exposed and their close contacts. We will continue to do that, but it's time now to expand our discussions and our strategies to include activities that all of us can take together. As the governor said, just since our last media briefing yesterday afternoon, we've had an additional 5 cases confirmed, all of them so far with travel exposure. So we now have a total of 14 cases that have been confirmed in Minnesota. And while we do not yet have evidence of community transmission, we believe it's important to take actions now to limit the spread of the infection and reduce its impacts on our communities and our health system. We've talked many a time about what we're trying to do. You see this graphic to my right here, your left. We're trying to slow down and spread out the impact of coronavirus in Minnesota. We have long since thought it is not possible to stop it, but it makes the world of difference if we can slow it down and spread it out, and that's what these strategies are designed to do. The broad set of recommendations we're making today will remain in place until further notice, and we recognize will impact many aspects of society, including our families, our faith-based organizations, our employers, our schools, and our healthcare settings, including clinics, hospitals, and long-term care. Each of these recommendations is designed principally to make person-to-person transmission less likely by reducing close contact interactions. That is, interactions with others within 6 feet for 10 minutes or more. That's what we mean when we talk about reducing the risk of person-to-person transmission. See, these are the kinds of contacts that tend to result in passing along this particular illness, as well as many other respiratory illnesses. It requires close contact for more than a few moments. The full set of recommendations I'm announcing today can be found on the MDH website, but the key items include these. Canceling or postponing gatherings with 250 or more people. This will include concerts, conferences, professional and amateur performances, or sporting events. Canceling or postponing smaller events, those with less than 250 people, that are held in venues that cannot accommodate social distancing of 6 feet per person. Limiting attendance to no more than 10 people for events or meetings that are specifically for and with the majority of participants who are at higher risk for severe illness from COVID-19. That would be settings of care or housing, for example, for the elderly or people with disabilities. Strongly want to mention that people and families at greater risk of severe illness should stay home and should avoid gatherings or other situations of potential exposures, including travel. We urge employers to use the tools that they have available, making telework arrangements for workers whose duties can be done remotely, staggering employee work schedules and limiting non-essential work travel. Healthcare and assisted living facilities should employ strategies including limiting visitors to their facilities, as well as various triage strategies before entering facilities. Faith-based organizations should follow the guidance for gatherings and consider offering video or audio events. I want to say many organizations have already been taking some of these measures, and we appreciate the work that leaders across Minnesota are doing, putting in place now and have been for recent weeks to help protect their organizations and the people they serve and their communities. And very impressively, working together to try to align those policies and practices for ease of understanding by Minnesotans. A lot of work going on to coordinate. There's certainly no doubt that these recommendations are going to mean inconvenience and disruptions for many healthy and low-risk Minnesotans. And we need to remember that for most people who become infected with COVID-19, the illness will be mild. However, for a smaller percentage of people, our elders and people with a range of underlying health conditions, there will be severe illness. So by taking these actions, we can help reduce the impacts to health and safety, especially for those Minnesotans who are at higher risk. They need the rest of us to do our part to protect them, while scientists race to develop antiviral drugs and vaccines that will protect all of us in the future. I'd like to speak for a moment about the particularly important topic of schools. The Minnesota recommendations include school-specific guidance for limiting close contact interactions. However, consistent with guidance from the Centers for Disease Control and Prevention, the state health department has not recommended that K-12 schools should close unless specific conditions exist and they are advised to do so by health officials. However, as the situation evolves, there may be points in the future where specific or broader closures would be ordered. Parents of children and teens with underlying health conditions should now consider distance learning as a precaution. I know that this runs counter to the instinct that many of us have to protect our children and to see closing schools as a precaution. And given the concern that we all have about a new virus, I don't blame anyone for asking these tough questions. But it's important for school officials and parents and all of us to understand a few things. First, evidence shows that children and teens are at the lowest risk from COVID-19. Second, community mitigation measures of the kind announced today are designed to slow the spread of a disease in a community. Third, evidence from other areas of our country hit by COVID-19 shows that early, short to medium closures of schools just don't have much impact on the rate of spread of COVID-19. According to the CDC, there might be some impact of much longer closures later in the course of an outbreak, but that modeling also shows that other mitigation efforts, such as we've been talking about today, actually have greater impact on the spread of a disease. In other countries, communities that have closed schools, for example in Hong Kong, have not had more success in reducing spread than those that did not close schools, such as in Singapore. So the reasons that we have not recommended closing schools at this time are based on what we know so far, based on evidence of where the risk is and what strategies are successful and not. And that's why we've been continuing to say we are not making broad recommendations for closure of schools. However, we know that epidemiology is just one consideration in these tough decisions. So we'll be working carefully with the governor and with the Department of Education to continue to keep eyes on this question, and we'll be just more and more trying to understand the circumstances under which closures might be considered. I would like to clarify some of what these recommendations don't include. I'd like to clarify that we do not mean this is a ban on going out of your home. Shopping for groceries and other items is not affected by these recommendations, although it's a good idea to limit close contact when you do so. And certainly people who are sick should not be shopping or using transit or doing anything else in public if they can avoid it. They should stay home until they recover. I also want to clarify that the recommendations to avoid mass gatherings are not intended to pertain to the normal operations of airports, bus and train stations, medical facilities, libraries, shopping malls and centers, or other spaces where larger numbers of people may be passing through. Even so, people in high-risk categories, the elderly and those with underlying conditions, should consider limiting these activities only to necessary outings for the time being. I'd like to just say a couple of things about testing. The governor mentioned that he's been in close contact with our federal officials to try to increase the supply of testing in Minnesota. So far, our state public health laboratory has tested over 550 people, samples from 550 patients that have come through the healthcare system. And again, we've identified 14 positive cases, 2 hospitalization, one of those more severely ill. Our capacity for testing is limited. We have been working hard to keep pace with the testing demand, but it's just a fact that we do not today have the testing capability to test absolutely everyone who might want to test for whatever reason. We've had to be judicious in the testing criteria and in prioritizing those for whom the test results are most urgent most quickly. Our supplies are a just-in-time challenge. The supply chain is very complex, and there are many, many components to it. It's not just the number of kits that you've heard about from CDC. Those test kits from CDC contain some, but not all, of the components that are necessary to do this testing. So the supply chain and what we're seeing just globally truly is an issue of concern that's a day-to-day management challenge for us. So we have asked the federal government to get us the capacity to test 15,000 people a month. That's what we'd like to see. That's what we'd like to have on hand and be able to meet the demand that we have experienced in recent days and that we anticipate going forward. I'd also like to mention that folks are thinking, well, wouldn't it be good if we could just test everyone, just not only people who have reason to suspect they may have been exposed? Don't we need to do broader testing in order to identify whether we already have the disease in the community? And in fact, as I will just restate again, we are seeking to expand testing capability, but we have been for several weeks now doing what we refer to as surveillance testing. So we're not only looking for COVID among the patient samples that come to us, we have a system in place with surveillance clinics around the state who routinely send us samples of patients who come in for respiratory illness. So we have a respiratory panel that looks at what are the illnesses that are showing up around the state. That's part of how we do our forecasting for disease prevalence. Since we've been able to test for COVID in Minnesota, we run the COVID test against all of those surveillance samples as well. So we do have some indication of what's going on around the state. We are looking for COVID, not just waiting for it to find us. Would we like to be doing larger volumes? Yes. But I hope it's reassuring to Minnesotans to know that we are doing more than just looking for what comes to us. I think that's very important. In closing, we know that these strategies are going to impact the lives of all Minnesotans, but we're hopeful that we can reduce the impacts of this outbreak by working together. All Minnesotans share the risks and the responsibilities now. For everyone, the responsibility first and foremost is to stay home when you are sick. I want to make clear how important this is and that it applies to everyone. And we understand that that's part of our culture, is to tough it out and go to work at all costs. But there's nothing more important than stopping the spread of an infectious disease than keeping the people who are sick out of circulation with the larger community. For communities and organizations, the responsibility means making temporary adjustments to events, operations, and activities to help make person-to-person transmission less likely. The virus that causes COVID-19 is spread primarily by respiratory droplets, as far as we know from the epidemiology so far, when an infected person coughs or sneezes, similar to how influenza is spread. It can also spread when people touch contaminated surfaces and then touch their eyes, nose, or mouth. So that protective guidance that you've been hearing from us over and over and over remains central to this response. We all need to cover our coughs and sneezes with handkerchiefs or with our sleeve or into the crook of our arm. We all need to wash our hands frequently and with warm soapy water for at least 20 seconds. We need to avoid as much as possible touching our eyes, nose, and mouth with unwashed hands. And above all, staying home when we are sick. More information can be found on the Health Department's coronavirus disease website. And we have set up a public hotline that is open from 7 in the morning till 7 at night during the weekday, on weekends when we need it. The hotline number is 651-201-3920. Finally, I'd like to just acknowledge that this is a challenging time for all of us for so many reasons. This is a major global challenge. We've seen the ripple effects that this disease is having in so many ways. And we know that there are many more questions than we have answers for today. But we have world-class infectious disease teams here in Minnesota, and I am so proud to represent them. I really want to express my gratitude to the hundreds of epidemiologists, laboratorians, communications and outreach staff, and others who are working on this effort at the State Health Department and in local public health around the state. They really are a world-class team. And with that, I'd like to turn it over to our Attorney General.
And allow me to thank you, Commissioner, and you, Governor Walz. I really feel confident that we are well-positioned with the best leadership we could possibly have. So I'm your Minnesota Attorney General and a member of the state's Executive Council. I am in full support of the Governor's declaration and the Commissioner's guidance. This is a trying time. We are meeting, we are working together, and I'm confident that we will see this through together. What you've heard is a kind of straight talk and direct action Minnesotans deserve and need. It's calm, clear-eyed, and together we can mitigate this crisis, flatten the curve. And again, thank you, Governor. Thank you, Commissioner Malcolm. One of the first things I want to share with you is that as the state's chief legal officer, the governor's authority under Minnesota law is very clear. Minnesota Statutes Chapter 12.21, Subdivision 2A reads as this: the governor may declare a peacetime emergency A peacetime declaration of emergency may be declared only when an act of nature or other specific situation, including epidemics, pandemic, endangers life, property, local government resources are inadequate to handle the situation. I believe those situations are obtaining now. The phrase act of nature was intended to cover this type of public health emergency. In addition, as a member of the Executive Council, whose members are the 5 constitutional officers, and is authorized under Minnesota Statutes Chapter 9, I will work with the governor to do everything in my power and use my entire office and everyone in it to help the governor and the commissioner mitigate this crisis and protect Minnesotans. And of course, as Attorney General, I'm working closely with senior staff to protect all of our employees who I might say have been working round the clock, and I'm extremely proud of the work they've done. My job as your Minnesota Attorney General is to help people afford their lives and live with dignity and respect. A big part of the job is protecting Minnesota consumers from scams, deception, and fraud. To that end, I say directly to Minnesotans, this is a good time to be careful. We want to hear from you. Our office lines and our website are open. We want to hear your reports if you believe scams, price gouging, other improper behavior is going on. It's disgusting even to think about scam artists taking advantage of a moment like this. Sadly, it happens. Not just now, whenever a crisis happens. We need to be on the alert, and we need to urge each other to be good to each other. Emerging scams includes things like this: setting up websites to sell bogus products, like fake COVID-19 vaccine and other unproven treatments. Also, using fake emails, texts, social media posts to deceptively solicit donations for victims. As your Attorney General, we operate the Charities Division, who has responsibility in this area. Our folks are working hard to make sure that charitable donations are legitimate, go to the right people. Please don't allow your compassion to be exploited in an improper way. Check in with us. We know every registered charity in the state. Also, imposter scams, where scammers and malicious emails impersonating government agencies like the CDC in hopes that you will click on a link and thereby download malicious software that will give the scammer access to your personal information. We've had dozens of calls to my office about this, actually more than dozens. We've had quite a few. To all Minnesotans, I say don't click on links from unknown sources. Get updated on information directly from relevant government agencies like the Minnesota Department of Health, not suspect emails. Ignore online offers for miracle health products, treatments, or vaccinations. These things just don't exist. Legitimate vaccines are being worked on now. You will find out from the proper authorities when they are actually available. Do your research before donating to any nonprofit or charity. Check in with our office. You can contact us immediately to report any suspected scam. In addition, the Attorney General's office has gotten reports of price gouging by some retailers of essential items like food, healthcare-related products, or food services, or medical supplies. If you see price gouging anywhere of items like these, please report them to us. The fact is, we strongly encourage you to share this information with you. With us. In addition, I know that legislative leaders are considering on strengthening, passing a law to ban price gouging. Most people don't know that price gouging is not currently illegal in Minnesota. I believe it should be. I pledge to legislative leaders my support in passing a law that protects Minnesotans from unconscionable price gouging. So let me say in conclusion, we're working together, and I'm very confident that our efforts are going to see Minnesotans through this situation. Thank you.
Thank you to the Attorney General. I think it shows the depth of planning that's going into this and the thought of protecting Minnesotans. Commissioner Malcolm and this administration's #1 priority as governor and as the administrator of the state is the safety and security of Minnesotans, and to look at all those contingencies and to build the coalitions necessary, both inside government and outside. I've been joined by Commissioner Steve Grove, Department of Employment and Economic Development, working with our business community, Commissioner Franz, who's implementing the policies across state government, and then Director Joe Kelly of Emergency Management as we've upped that position. That we are confident that we are in a position to protect Minnesotans. The steps being taken today are simply predictable in that system as we forecasted that we have gotten to a point where the emergency order and declaration is needed, and that the tools that are in that toolbox as we move forward, our anticipation is some of them will need to be used. And as you heard Commissioner Malcolm discuss, this is fluid situation. And as many of you would, I think, attest to, it was 2 weeks ago when we gathered with all legislative leaders before we had any cases at all, predicted where we would go. Time seems to compress and expand at the same time. But this is why you prepare ahead. This is why you have systems. This is why you follow these to make sure that Minnesotans are protected. And my, I guess, closing on this to be before we take some questions is we need Minnesotans' help on this. That I think by now the idea that this is nothing is put to rest. This is a serious pandemic. While some people may feel invincible and strong, our neighbors are not. And I think it behooves all of us to follow these closely, to follow those basic things of washing hands for 20 seconds, of covering our mouths, of making sure we stay home. And it's our job to provide the tools necessary and all those potential issues that come up with an hourly wage worker staying home, an uninsured person being able to get a test. All of those things are things that government is working on together. We'll get through this together. We know that there's going to be some long days ahead. As I again forecasted just yesterday, that by this time next week, things will look different. There will be disruptions to our daily lives. We'll get through this together, though. We'll keep our neighbors safe, and we will do the best we can to ensure that Minnesotans model the type of behaviors that will make this pandemic follow the bottom curve rather than the top. And with that, we'd be glad to answer your questions.
Tell us about your decision to not make an edict to close the Capitol or state buildings.
Yeah, and this is a decision that is made by the legislators together. We all spoke collectively. The first thing I would say is this is the people's house, and access to democracy is critical. I think some of the limitations in terms of gatherings, the 250 applies to here. I think it's very, very important that continuity of operations and belief in the democracy continues forward. Best health advice that you're hearing from the health department says that we can function here, but I think it is probably many of you are anticipating this as the levels continue to increase. Some of those things may need to shrink down. I would use this as a time that I think it is wise if we finish the things we need to do. I'm grateful that a bill is coming to my desk for disaster mitigation because, as I told Director Kelly, we are going to have to simultaneously, more than likely, layer on spring flooding and responses to that. And they moved that, so that money's there and ready to go. I would say the COVID responses that we're asking for, and if they can get their work done as quickly as possible, I do think it makes sense in an economically broader perspective of a jobs program and a stimulus, is to get that bonding bill, that local jobs bill, done and move on. But I anticipate, and again, we weigh this on, it's the people's freedom. The idea of telling people they can't come to their capital is a pretty significant step, but as you saw in Canada, they ended up suspending that. We certainly can't do democratic action here without the public having access to it, meaning we can't hold major hearings and pass legislation where nobody has access and nobody can weigh in. That is not what's acceptable. Go ahead.
Commissioner, one of the greatest resources we have, especially at some point in the future, will be ICU beds and ventilators. Hospital Association estimates we have 500 ICU beds in the metro, about 450 ventilators. But I understand through a hospital for a health department spokesperson, one of your people, that the hospitals are not providing real-time information about the availability of ventilators, how many they have, how many are currently available. They consider this proprietary information. Do you plan on asking them to make that information available to you? And in turn, do you plan on making that information available to the public? Or do you have concerns about creating a panic that there are not enough ventilators?
What I can tell you today, and I think issues of what data is appropriate to share, for what purposes, is something that we're continuing to look at. But I can assure you that we are working ever more closely with not only the Hospital Association, but directly with health system leadership, Mayo, Fairview University, all the major systems that are going to be caring for these people. And there are, I think I've mentioned before in briefings like this, there are 8 healthcare coalitions around the state in 8 geographic regions that are kind of our critical infrastructure for collecting that data, sharing it amongst the participants, sharing that, and yes, we are asking for that to be shared with the health department so that we can have eyes on where there are emerging challenges. And we have talked about the importance of the strategic national stockpile at the federal level to be a source of personal protective equipment and equipment such as ventilators. Can't help us with ICU beds, but for things like masks and those basic supplies, including ventilators, we're looking to that strategic national stockpile to be a source of additional resources so that as we see potential shortages emerging in Minnesota, we can quickly move things around.
So is that true that hospitals are not providing you that information about how many ventilators that they have on hand?
I have to say that I don't know that for sure, but I know the conversations have been to make sure that the data flows from those regional coalitions where they do have that information up to the state. We're working to make that
Do
happen.
you believe that's an accurate number of 450 ventilators in the Twin Cities? Do you have reason to believe that that is a solid number?
If that came from the regional coalition, yes, I do believe that they've got that data.
So these are the recommendations, and I'm curious if, under the recommendations, because there seems to be slightly inconsistent messaging here. The schools are not being closed, but gatherings of 200 or more are being asked to be canceled or postponed. How do you enforce these recommendations, one? And then two, given sort of the lack of testing, I mean, is this too conservative an approach at this point, given sort of the national declaration? I'm trying to get a sense here about how you enforce these recommendations and whether there's another step that could be taken.
Yeah, this is an opportunity to clarify that. So what we are saying today is this is our specific guidance. This is what we believe all of us should be doing in these various settings based on what recommendations from the Centers for Disease Control and Prevention and what we've seen as successful community mitigation strategies in other epidemics and emerging experience from other places around the country. These are recommendations, but they are strong recommendations. We're not saying consider. We're saying please do. However, they do not at this point have the force of a regulation or a law. As the governor indicated, that's part of the value of having the emergency, the declaration of a peacetime emergency, that if we find the need to make these recommendations more in the form of requirements, the governor has got the authority to do that. We believe that it's appropriate now, again, the governor referenced this, based on what we've seen in other communities with the potential for the spread to become exponentially more rapid. We just want to be prepared to have access to some of those more regulatory measures should we need them. We have always said we try to stay a step or two ahead of where we actually are in terms of the pandemic, to be able to quickly implement the next level of strategies. And that's what these announcements today are about.
Can you foresee making these mandatory?
Can the governor actually order gatherings not to take place at some point? What kind of criteria are used for making those decisions? And if you have a timeline, do you have any feel for how soon those decisions might have to be made?
I think that's the whole point of the emergency declaration, is to say, should we need to make these things mandates, that the governor would have the power to do that. This is our best guidance, and I must say we've been really grateful, as I said before, about the leadership in the community, in the business community, the healthcare community, the long-term care community, the nonprofit community. Folks are already doing this, but they've been looking for more guidance and more uniformity to the extent we can give evidence-based guidance on how to reduce the risk of person-to-person transmission. So that's what we're announcing today, is the things that we know are available tools to help reduce the risk of person-to-person transmission in these close contact settings.
Commissioner, I just had a question from a teacher specifically saying if we're supposed to limit to 250 and below, how can we have lunch in schools when there's as many as 1,000 kids in one space at a time?
These are some of the practical questions we are needing to work through with our colleagues in education and in contact with school officials directly. To how can some of these mitigation strategies be applied as a practical matter? I have to be honest, we can't answer every question today, but the general principle of let's do what we can to minimize large gatherings is kind of the overall guidance, and we'll be working much more closely to try to answer specifics like
I'd
that.
like to follow up just a little bit on this. This is a tough one, and I think the broader question you're asking here, this is about reducing a pandemic in society. We are not going to have people out there writing tickets for having 251 people in it. That's not the purpose of it. The purpose is to provide the guidance, and coming from healthcare experts who are telling you, do not gather in larger groups. I want to go back to this issue around schools because we have spent considerable amount of time, and I think I am probably as well positioned to talk about this as anybody. I understand when we put out social distancing issues in there. As a classroom teacher, I had 43 kids in a classroom that should have had 20. You cannot social distance in there. And so these are the issues that start to come up where you have to start to think about how is that going to impact? What do the healthcare experts say about the transmission of it? What does it say about the risks in those schools? Talking about things like rotating lunches. There's things that are suggestions that are in here. But I do want to get back at that. This is one that we are weighing and is evolving over time. That there are districts, and of course Washington State and New York State, two of the states most hit by it, did not issue blanket closings of schools. States like Michigan and New Mexico that have recent and smaller numbers did. These are going to be evolving decisions that need to be made. And this one's a challenge for me because I think it goes back to what the commissioner said. Your instinct is to protect your children. One of the things is that the epidemiologists will tell you this, and I got off the phone with one of the commissioner's former colleagues with Mike Osterholm, who in no uncertain terms says do not close schools. He said the implications of spreading throughout the community when they go home, being cared for by parents. 35% of the nursing staff in this nation has school-age children. It is estimated that 20% of them. So when I call the healthcare CEOs, they're telling me don't do that because the implications are on this side. So we're weighing these things as suggestions. We're weighing them against a set of criteria that is science-based. And I think the difficult thing is I'm telling you this as the father of a 13-year-old, our kids are scared about what's happening. We need to learn how to talk to our children and what that means, and they're worrying about going to school. So I hope all of you, as you're thinking about this, these are things that people need to do. We are asking them, this is not a suggestion to wash your hands. Wash your hands so you don't kill your neighbor who has an undermined thing. I can't stress it in so many terms that we need to really start trying our best and trying to strike that balance of allowing society to function. That's this interest. I think for many of us, it became very, very real when the NCAA tournament went away, when baseball went away, when the Masters went away. When Tom Hanks got infected, as I said, whatever had happened, this is coming home to this. These are science-based and societal measures, and we want to let everyone know the tools we have will keep ramping up. There could be a time, and it's happened in counties in Washington, where the governor did have to say, there is a force of law behind this. There will be no one gathering in more than 250. And at that point in time, most of laws are dependent on people following them voluntarily, not enforcement. And so we're making the case on this. This is the best way for all of us to stay safe. These are recommendations based on science. We're struggling with the hard ones because I can tell you we are hearing overwhelming on both sides of this. Close schools, don't go close. Close schools, don't go close schools. I am gathering all that best information around us, and we will make real-time decisions about that. I do think that message that is being echoed, Minnesotans, just like Americans across the country, need to prepare for some significant disruptions. And I think the thing that has not yet been talked about, there is a pattern that the healthcare folks could tell you this, that there will be a spike and a lull and a fall spike, which no one's talking about yet. There will be a fall spike again when this thing comes back. And that there'll be lessons learned by then, but we will not yet be to a vaccine point, and we'll have to think about that. So when you're closing, a closing for a week or two may be warranted in terms of resetting, calming down. It probably, as you heard the commissioner say, won't have a statistical impact on transmission. So that's the challenge. If that
How will enforcement work if it gets to the point that you need to make these
Well,
mandatory?
at that point in time, we'll start talking about that, of where it's been. And I think for many of us to know, this is pretty uncharted territory of doing this. And I think trying to keep societal order, and I take this very seriously when executive powers are granted to me, and there's a process in place, so all of you probably know this one, that this executive order has the force of law for 5 days. At that time, the Executive Council will have to meet. If they vote to continue that, it will continue for 30 days. At the end of that time, both houses of the legislature will have to come together and end it. If they do not do that, it continues on indefinitely until they do that. If they ask to come back and end it, law says they are guaranteed to come back and end it. So this is evolving. Again, what I would say is it is not our desire to try and punish, arrest, or fine someone for doing this. It is our intent to give you the best advice, the best guidance, and then implement that in a way across society that is the most orderly to ensure that people stay healthy, are able to work when they can work, and are able to get back to work and to the normalcy once we come through this curve, which we will.
Commissioner, hold on. Hey, we're
We're
going over
getting
here
so
first.
many questions from parents right now. Should they, you say this is evolving, should they start coming up with a plan that school could be canceled for weeks at a time?
Yes, that's a great, and I think if I'm conveying anything, I think that's it. And we're talking about everything from distant learning, but of course, many of you in this room are very familiar. One of the things I continue to ask about is we do not have border-to-border broadband for folks who are out in greater Minnesota. Yes, I think parents should, like all of us, the precautions you should take preparing, not a run on the local Costco, but smart things that you should be doing to prepare. I think schools are starting to prepare that, of what lessons that we could provide forward. That is just good contingency planning. And I would encourage school officials, parents, to start thinking in that direction about what would this look like if we do that. We will make this decision and talking in collaboration. I can tell you the issue around the schools is, I wouldn't call it controversial. I just think the schools of thought in this are very polarized, and we're trying to weigh that data. But it's a great question. I would encourage Minnesotans who are listening to start preparing for that, to start doing what you can do so that we are able to continue to educate our children.
Dave.
You got it.
Governor, back to the topic of schools, I think this is for Commissioner Malcolm. This is not to contradict your decision at all, but can you give us the best medical knowledge right now? Can school-age children be carriers of this? Can they spread it?
You know, I think this is where, as the governor said, we really understand that epidemiology and the public health perspective is one very important, but not the only criterion here. What we know is that that school children are a very, very small percentage of the cases globally. The Chinese data is probably the most thorough on this. That they're just not seeing cases of child-to-child transmission nor child-to-family transmission. We do know that kids can have the virus and not be symptomatic themselves. But as a percentage of the transmission, it's very, very small. Not zero, but very, very small. So that's why we say school closures would not, on the face of it, be indicated as a primary strategy for reducing transmission, but there are these other considerations.
Governor, I have a follow-up. You mentioned the legislature needing to come in to end that peacetime emergency. Does that mean you need the legislature to stay in session and not go sine die early?
No, not necessarily, because the way I understand the law is written that there's a requirement to call that special session, then to call them back. So that is maybe the way that would look. I think they're discussing whether they end that or whether they keep it open indefinitely and they keep two people that come in and gavel it closed each day. Our encouragement here from me, and I think working together, is the partnership that we have and the trust that's built up. We just need to make sure there's these functionings. And I think it's important to have those checks and balances. That means that this emergency powers are not unlimited for an indefinite period of time, but they have to proactively come back. That means if the trust is there, there's no need. I mean, the only thing you would have an issue on this is if they believe we were overstepping it, they believe this was over, they needed to come back in and end it, because those powers would just expire if we didn't need them anymore.
Kevin, Steve, John.
Got it.
Thanks. Governor, I'd like to hear a little bit more about your conversation with the Chief Justice yesterday. I was in conversation with the judicial branch, and they said they were gaming out scenarios where they may cancel some court hearings, and I'm wondering if you've heard any more about that, if that would be civil hearings. Perhaps the AG might want to pipe in on that as well.
Yeah, and I would, being in that meeting, and also I would like to note, the Attorney General, the Secretary of State, and the Auditor were in there, so all the constitutional officers were in there. I think what was very encouraging to me is that, as we put out several weeks ago in state agencies through Commissioner Franz and then through the other constitutional offices in the judiciary, plan for continuity of operations. The Chief Justice had done that. They are already triaging and prioritizing cases that needed to go first, starting to rearrange their dockets to make sense on that. And she was confident. I certainly don't want to speak to her, but I can tell you I left the room very confident that the judicial branch feels like they have a plan that they could continue on. They could continue to take the most pressing matters. Obviously, like all of us, it would be in a reduced or a changed capacity, but it would still work. Attorney General, what you heard.
Yeah, thank you, Governor. So some cases where people are in custody and have a right to a speedy trial, those cases would have to be prioritized. There are other cases where you might be able to delay those and stretch out that time period. So the
Civil cases would be among those.
Civil cases among those. And of course, there are certain civil cases, for example, an eviction case or something like that, where you might need to speed that up. But I'm confident that the Chief Justice and Judiciary are ready to make sure that the continuity of government goes forward. The rule of law is a part of the continuity of government, and the rule of law is critical in these times. I will point out that all of the powers under Chapter 12 were passed by the state legislature in a democratic way. So even at this time, where the governor will be authorized to suspend and invoke certain special powers, they were arrived at democratically, and that involves even the courts and other things like that. So there you go.
Steve.
Yeah, Commissioner, the new cases, where were they and what can you tell us about the conditions?
The 5 cases yesterday, I'm sorry, I can't break down off the top of my head the counties, but we are seeing counties around the state, mostly in the metro area. The 5 cases yesterday, again, were out of over 300 people tested yesterday. And what I can tell you again about conditions, that of the 14, only 2 have been hospitalized, and one of the hospitalized persons is in quite good shape. The other is unfortunately more acutely ill.
John, Brian, Peter.
Where are those hospitalized people?
Guys, John Perlman.
John, I believe, and I think, Commissioner, I believe a press release went out on that simultaneously with us being here. So I think the counties and things will be listed on that.
Where the hospitalized individuals are?
I'm not sure that, you keep that.
Yeah, thank you. We actually work pretty hard not to disclose too much information about the patients and where they are to protect their confidentiality.
Perlman, Bax,
Yeah,
Peter.
Commissioner Malcolm? My colleague Boyd Hooper interviewed 2 women today. They say 6 of the 17 people in their office are homesick. One of them traveled internationally, one of them didn't, and both were denied tests by their doctors, were told they didn't qualify. One because of her age, even though she traveled internationally, and the other just because she hadn't traveled internationally. What do you say to people out there who are getting anxious and wondering if the numbers are underreported because they just can't get enough people tested?
Well, again, we acknowledge that it would be desirable to have the capacity to do more testing. And we're working on that. And we're urging the federal government to work with us and to make broader scale testing more available. And quite honestly, what would be optimal would be if we had the kind of rapid tests that we can get a rapid flu test in your doctor's office. That doesn't exist today. But instead of this process of really having to be judicious in the testing resources because of the pressure on these complex laboratory processes, that it just has lent itself to the need to be judicious about testing criteria. We acknowledge that the testing criteria have changed from CDC. It was quite a bit more restrictive early on. It's been broadened, more clinician discretion about the severity of symptoms and whether they're able to rule out other causes of the infection or not. I can't comment on the specifics of those 2 situations, but it is the case that folks are not able to just get a test on demand, and I think that's important given where we are with our testing capabilities. But the goal is to be able to make testing more widely available. We just can't do do it through the existing system alone.
Brian and Peter.
For people who have to or choose to stay home, what employment protections do they have? And is there any wage replacement power you have now that they could tap into the unemployment system or anything like that to make sure that those, short of a new law from the legislature?
Yeah, so we are looking at our employment insurance program to make sure that it can cover workers who have to stay home for no fault of their own, which is the core tenet of unemployment insurance. One of the things that we're recommending, and you see this in the packet that has been passed out, is that we make some changes to the unemployment insurance program to make it work better for workers. One of them is to limit a waiting week that currently exists before those benefits kick in. Another is to ensure that employers don't incur charges if vast numbers of their employees need to take time off or leave of absence for unemployment insurance, for unemployment reasons. Paid sick time is always better than unemployment insurance. It pays more. I would also just say this, for those who are wondering about the unemployment insurance program, the trust fund is in really good shape. It has about $1.5 billion in it. We only spent $800 million last year, so we're in good shape there. We don't expect that to be a general fund need, but we do want to make sure that program works for Minnesotans.
Are they protected from being fired if they stay home without the consent of their employer?
There are protections in place in the program, and the Attorney General can maybe speak to that as well, but all those laws continue to apply in the situation. One of the other things we're looking at for paid sick leave is currently in the state statute, we don't allow paid sick leave, or there's no provision for paid sick leave related to pandemics. And so you'll see in some legislation that Representative Knorr currently has in motion that we want to expand pandemics to the qualifications for being able to take paid sick leave as well.
Brian, I may follow up if I could
Sure.
on this. Thank you, Commissioner Grove. This is one of the issues that we're looking at. It's one of the reasons for the legislation. But if I could, I would like to make a plea. Please try to do all we can for our employers. I know this is a tough situation for everyone, but from the public health standpoint, we cannot have people making the decision to go to work based on the salary that's there. We need folks to cooperate with us on this. And I would argue, and maybe the Attorney General would speak to backing me up on this, if there is not a protection for that, there darn sure should be. If the state of Minnesota is asking you to stay home, and the thing that I want to be partnering on this is, if this would become, and I would never anticipate in Minnesota, a problem, those are the type of things we need to look to make sure that that's not happening. Because all of this decision-making and all of this emergency power is meant to keep that curve flat, to keep people healthy, and people feeling under pressure of either loss of their job or loss of wages can't be the reason they're going to work. We have to get that piece right.
Peter, then Brianna.
Governor, this room is in violation of.
It is, and no, and I said the irony of that, we all need to think about that, of getting in there. We are, if you notice, starting to do this. The Lieutenant Governor is not here for a reason. We have moved to stage 2 of our continuance of operation plans. I was briefed by our manager about what my home would look like, that where deliveries would stop going into the residence, what the shift shake would look like of the people working the residence and cleaning the residence, and one of those moves was this. And I think it's a decision, and we talked with, of course, Teddy and our team about making sure the press has access, and how do we have to do it in a bigger room to protect all of you, because this again goes to the thing, we can't get to the point where we can't do a press briefing with you and get this out to the public because of this. So I think these are the things the Commissioner's talking about, of suggestions and things where we go. I'm hoping that none of you in here would have come here sick from work. I'm hoping you think about washing your hands, not touching your face, the things that were out there. But it is a point that is valid. And this is striking that balance, obviously, with community safety in place. I think all of us know that there would be a spectrum of this where we would use emergency authority and no one leaves their house type of thing. Well, that's not possible, not feasible, it's not functional, and there would be deaths caused by the economic chaos and the other things that would happen. So trying to go on that spectrum of sliding. So I hear you. We're thinking of these things. I hope you see us, and we're modeling it across state government. We're modeling it in our administration. We are doing meetings in the large cabinet room with chairs between us now. So we are trying our best, and I'm telling Minnesotans, it's hard to do. And my entire career in life is shaking hands and picking up babies by instinct, and I'm going right for them. And I have to hold myself back, and it's uncomfortable for some of us to do that, but we need to continue to work on it.
Brianna.
Commissioner, do you think community spreading is already happening? It's just not showing up in testing? And do you think people are taking social distancing advice seriously at this point?
I really would like to thank Minnesotans for listening, and we do see evidence that people are adopting new behaviors, and encouragingly, we're even seeing it in the flu numbers. So the same basic protections that help us avoid COVID are so important for the other seasonal illnesses that are always with us. I do think that the concepts of social distancing, we have to keep talking about it. What do we mean by that? Be increasingly specific. Your question about, do I think community spread is already here? We've always said it's certainly possible that it is. And as the global spread and as spread in other states, just by very nature of the mobility of our society, we have people coming into Minnesota every day from California, Washington, all the places where we know there is community spread. So it would be pretty naive to think that it won't be here or probably is here already. We haven't found it. I am reassured, though, that it is, I can say it's not widespread. If it was, we would be seeing it in the testing we're doing and in the healthcare system. Do I think it could very well be here? Yes, I do. But our job is to keep it contained to the extent possible, and as we've said several times, that the success or failure of slowing down and flattening that curve is what's going to make it possible for the healthcare system to manage this as they have successfully managed many other kinds of outbreaks, or to have some of these shortage situations that we're all concerned about.
We're getting a little tight on time, and the President's address starts in just a few moments, but we'll take a few more in the back, then Ricardo.
Thank you. Governor, you were talking about the technicalities of the state of emergency. We have 12 communities that are recognized federally sovereign nations. How does your declaration impact, and how will you be working with those communities?
Yes, and this is one especially us trying to change that government to govern and that sovereignty of those nations. It works in conjunction with the Bureau of Indian Health, working with MDH, that those recommendations, we work closely together. The tribal leadership has sovereignty over making sure, and they will be echoing many of these. And at this point in time, should we need to call the National Guard to assist somewhere, we would have the authority to do that. But with the relationships we're doing, those would be done in consultation with the tribal nations, making sure that it was in the mutual interest that we would do that. So this is going to be, there's both a formal layer to that and there's an informal layer, but it's a question that is good. It's a question that we understand, especially in some of the rural communities on our sovereign nations. The healthcare issue is going to be big.
One question on outreach in other languages. I think on the previous health department call, there was talked about how materials are being translated into other languages, but given the number of languages spoken in the state, how are you ensuring that accurate and credible information is reaching households where English is not the primary language?
That continues to be a real priority, and I think we're making good progress at translating materials into the most commonly used languages, but we need to look at real-time connection with translation services. And we're also very aware, by the way, that not all of our communities rely on written media or electronic media. And so the face-to-face, community-to-community interaction, working with community-based organizations that serve our communities, working with community leaders, not just through written communications, but personally, is very important. And we have a ways to go to be able to get out to everywhere we need to get to have those community-specific conversations.
Dave. Practical question. A lot of families, spring break is coming up. They have family vacations planned. Planning to go to Florida, not to Disney World, but something with your kids. What's your advice for people with travel planned via the air?
Well, again, it's one of those places where we recognize real disruption to people's plans and lives. We've been saying for some time, if you're in a higher risk situation, if you're an elder or a person with underlying health conditions, it'd be a really good idea not to travel. There is no guidance from the CDC at this point to limit domestic travel, with that major caveat that if you're sick, please do not get on public transportation. If you're in a higher risk category, not a good idea to expose yourself to the risk of travel. So I think we're just encouraging people to be thoughtful. If trips can be postponed out of an abundance of caution. Where are they going? Is it an area where we know there's widespread community spread? But again, as the spread happens more and more, that's just going to be less and less relevant, and folks are just going to have to consider.
Can I follow up,
that.
Diddy, just on this? I'll just say, Dave, because I say this as a fellow Minnesotan. We were taking our son and a friend to Disney World. The one thing I would say, and this is something maybe with the Attorney General and working with our businesses, one of the things I know families are going to be concerned about, as we are, of the non-refundability of airline tickets and things like that we're hearing. My niece was running Boston Marathon. My wife was going to go do that. Those tickets are non-refundable. And some of those types of things are going to be real financial things that it was by no fault of their own that they're canceled. And many people just saying, well, we'll give you a credit, you can travel here, that doesn't really work. So I think we're hearing that. I don't know the answer to that today. I think federally some of the legislation and think in the state of this consumer protection piece around what happens on the unknown.
Last question.
You referenced Michael Osterholm. Yesterday, he was on a podcast, and he said very pointedly that people don't understand, using these words, the misery, pain, and death that we are likely to experience from that. He seems to think it's very important that people understand that reality. Can you address that?
Well, I certainly think we're taking this seriously. I think, unfortunately, and I, again, want to be just absolutely clear, there was a lot of mixed messages coming out. We have statements that we had 15 cases from the president, and that would go to 0 just a week ago. No one believed that. We all understood that, and I'm glad we were planning accordingly. So I think now we might be in a little better place to tell people the seriousness of this. I think it's always a balance of understanding the seriousness without panicking people, to understand what the risks are, the mitigation of risk, and then for us to continue to protect the most vulnerable. But I want to be very clear. We're taking this very seriously and have been for weeks. It feels to me like now, and I can tell you that the responses federally and specifically from the Vice President's office over the last few days, he personally called. He asked me about the kits. I called today and said we didn't have enough, and Dr. Birx got back within an hour and said they will get them to us. That's pretty unprecedented, and that's only been over the last 24 hours. So I agree, and I think people need to understand this, understand where the risks are, but also understand if we do these things right, we really minimize that risk. We really protect those most vulnerable. And for the vast majority, as the commissioner said, who aren't at near risk, they can help protect others.
All right, the governor's going to get back to it. We're going to turn it over to the president. Thank you, everybody.
Yeah, thank you.
Thanks, everyone.
these guys are done. Well, good afternoon. I want to keep my comments brief, but I think you should hear from the legislative body as well. The overriding theme is let's keep calm and carry on. It's from a generation ago, a different set of danger in front of that people, but keeping calm and carrying on is, I think, is really important as we're addressing this issue. I want to focus on what the Senate and I think the legislative bodies will do. Under the advice of medical experts, the Senate's doing its best to model good behavior, limit interactions with larger groups, but still continue the business of the state. I think that's important that we remind folks that we don't intend to close it completely down. We want to say that the Senate is open. I believe the House will say that the House is open. We're going to do the people's business, but at the same time, we're going to listen to medical experts about how to do that in a way that's safe. So Minnesota's in a good situation to handle the pandemic. We have a stable budget and an excellent health care system. As I mentioned, Mayo Clinic in the past and the University of Minnesota, the plans that we've already set forth put us in a good spot. We are going to be here to work with the governor. The initial COVID funding bill moved quickly, both the House and Senate passing that. That's not easy to move something like that fast, but it's because we recognize we want to provide resources for the governor to do the things that we need to do. We're not, as I mentioned, we're not closing the Capitol because the people deserve to have their voice heard. We are, however, encouraging people to make their voice heard via phone calls, emails, and smaller groups. Our senators and staff are here to take calls, respond to emails, and help constituents who need assistance. And if somebody does come down, we're going to see them, but typically we're going to ask them to make an appointment to try to make sure that we're mitigating how many people are in there at the same time. The measures we took to limit access in the Senate building was out of caution to our staff and to the public. As you heard from Commissioner Malcolm, the idea of if we have less contact, we flatten that curve. If we flatten that curve, our health care providers can take care of the people that are really going to need the help. It's 80 or 90% that I think will barely know that they have this, but for those that it's a life or death situation, we want to make sure that they actually can get the care they need. So by flattening that curve, we have the opportunity to make sure we have all the resources that are necessary for the people that are going to need it. We can still meet the public. We're just limited and keeping the numbers to a smaller group. We haven't had a specific amount, but we just want to make sure we have smaller groups coming in. The hearing rooms in public areas are still open at this time, but again, we want to encourage the public to consider your own circumstances before coming down and think about, if you're not feeling well, we don't really want you there infecting other people. So now that the governor has declared the peacetime emergency, the House and Senate leaders will be meeting within the next few days just to talk about where is it that we want to go, what are the things that we want to get done, and on what pace, because what we all don't know is what we don't know. It's the unknown that we don't know, but we're open to moving some of the bills earlier if we can, and that's where we have to work together, the House and Senate, Democrats and Republicans, and beyond that, I really can't say more about that part of it, because it's only my opinion at this point. So, with that, I can take a couple of questions. I'm not the medical expert, but I wanted to let you know what the Senate is going to do and that we expect the Capitol to be open. The main reason that we want the Capitol open and the legislative bodies functioning is we want to work with the governor with this. If we decided that we would go sine die and finish early, then it's up to the governor to make the decisions. We feel like we should be part of some of the decisions that need to be made, and so we want to remain here through the rest of the session.
Senator, with that peacetime emergency order, the governor just laid out a timeline, and there was one aspect that if it went longer than 30 days, the legislature would have to be in to approve that. Does that mean you need to stay in as long as possible, perhaps?
Well, and that's what we're going to talk about. His declaration is 5 days, and then his executive, I forget the title, committee can give him another 30 days. So 35 days from there, the House and Senate have to decide. And so right now, that would be within our normal session, even as I've described it. And we have to decide what do we want to do, because we want to be a part of these decisions. We want the governor to have the resources he needs, but we also want the legislative branch to be part of what's going on.
Yeah, do you kind of increase your relevancy by not having to have him call you back by staying in?
Well, we decrease the relevancy of the legislative branch if we finish early and let the governor do everything.
Senator Gazelka, in isolation, a statement you made on television yesterday sounded uncharacteristically, nakedly political. And you said, if we go sine die or stop, then the governor has complete or much more authority and we're not engaged. So I want to make sure we're engaged all the way. Do you want to take another run at that? Because it sort of sounds like you're considering politics instead of public health. And
no, not at all, because it's the legislative branch, which the House is controlled by Democrats, Republicans control the Senate. The fact that we're an equal branch of authority, I don't want to finish early and then let the governor move forward. It doesn't matter what side of the aisle you're on, it's the difference between the two branches of power.
Mr. Leader, the governor is still saying, let's wrap up this bonding bill early. Is that possible, given your differences with him over taxes and that you're going to remain, obviously the legislature is going to remain in operation here through this?
Well, and that's what the four leaders, the House and Senate, Republican and Democrat, are talking about, will continue to talk about. We are having communications with the governor. We all recognize that there may be some benefit to finishing that bill earlier, some tax relief and a few other items that the governor thinks are important or that we think are important. And so that's what we have to hash out in the next few days.
But just to be clear, tax relief in some way, shape, or form would need to be in that bill if you were to finish it early. Would that be correct?
I don't know yet. We'll talk as the four leaders and make that decision. It's important to us that there is some tax relief. The governor's talking about a $1.8 billion general obligation bonding bill. And we think that rather than put that all back into the economy that way, we think you should do some tax relief into the economy instead, a portion of each.
We've been asking you over the past few days about the House's coronavirus priorities legislation, a sick time, free testing, expanded powers for the governor. What are the Senate's priorities for coronavirus legislation?
Well, first of all, we're listening to what the CDC is talking about and our healthcare professionals as far as their needs and focusing on those resources. We're not really focused on new policies at this point, just moving forward with what we need to do right now. That doesn't mean there won't be discussions about those things. It's just that that's not our priority at this moment. It's getting the dollars we need into the system and getting the bills done that we need to get done, especially if we have a small window of time to get the big things done. So that's where we're at right now. At this point, I'm not moving forward with any of those things. I've asked the other leaders, let's focus on the things that we all agree on. Let's make sure we get those done, and then we'll deal with the other things after.
Senator, is there any doubt in your mind that the governor has the authority to do what he did today as far as a peacetime declaration, that this is a act of nature?
No, I appreciate that the governor moved forward with that. We were in good communication. Declaring the peacetime emergency gives him some resources that may be needed. So there's no disagreement, I think, among any of the leaders that was a good step for him to take. We just want to make sure that the legislative branch is walking with him in the future steps that he's going to make.
Given the economic shock, what are your thoughts about the budget surplus we have? Are we going to still have it?
Well, we still have a budget surplus. I mean, yes, the markets went down, most of that, I think, based on fear, and then the decisions that are happening around canceling everything. But I think our economy will bounce back. It's just that we have to figure out where the path is going on this. The surplus is still there, and I think putting some in bonding and doing some tax relief and taking care of some of the basics is still a good idea.
Following up on that, because as you know, the budget surplus is a projection at this point based on the economic forecast. It's not necessarily a real number, and there's 16 months left in the budget. In this current cycle, the governor's supplemental budget yesterday leaves $1.2 billion on the bottom line. How hard would you be pushing for tax cuts amid sort of just the rising uncertainty over the U.S. and global economy?
With the same effort that they want to spend money on a bonding bill, you'll see a similar effort related to tax relief. In the end, if we don't agree, it will all stay on the bottom line, and that's not necessarily negative either. But I truly believe the four leaders of the House and Senate and the governor have been working well together. I expect us to do some things that all of Minnesota will benefit from. Yeah.
You said the economy would bounce back. How soon, in your mind, is?
I have no idea. You know, it's you know, but just watch some of the people that invest, and when they start putting money in, that means they have confidence. So with that, thank you. I just wanted to give you a brief position where we're at. Thank you.